Hello, I'm Karen Hammond. As a registered nurse practitioner, I have been working with couples trying to conceive for more than 25 years, and I understand the stress and frustration many couples experience. These directions are meant to complement, not replace, the directions you receive from your doctor or nurse. They should be used only after receiving directions from your healthcare professional. Do not use Pregnyl for injection unless your healthcare professional has taught you the right way to inject it and you understand everything. This video program is an educational service provided by Merck & Company. Pregnyl, chorionic gonadotropin for injection, USP, is approved to induce ovulation in pregnancy in women who have problems with ovulation and who have been appropriately pretreated with human menopausal gonadotropins, medications containing follicle-stimulating hormone, FSH, and luteinizing hormone, LH. Pregnyl will not help women whose ovaries do not work at all, primary ovarian failure. Important safety information. Do not use Pregnyl if you are allergic to human chorionic gonadotropin. Pregnyl should be used in conjunction with human menopausal gonadotropins. Pregnyl should only be prescribed by physicians experienced in infertility treatments. Pregnyl may cause ovarian hyperstimulation syndrome, OHSS, which is a serious medical problem that can happen when the ovaries are overstimulated. In rare cases, it has caused death. OHSS causes fluid to build up suddenly in the stomach and chest areas. OHSS may occur after treatment with Pregnyl. Call your healthcare professional right away if you get any of the following symptoms: severe pelvic pain, lower stomach area, nausea, vomiting, sudden weight gain, or reduced urine output. Pregnyl may also cause the rupture of ovarian cysts, resulting in internal bleeding, hemoperitoneum, multiple births, and artery blockage by a blood clot, arterial thromboembolism. Other side effects with Pregnyl include headache, irritability, restlessness, depression, fatigue, edema, and pain at the site of the injection. If you get any side effects that concern you, call your healthcare professional. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Full physician prescribing information is available immediately following this video. If you have any questions, please contact your healthcare professional. This is what you will need for the injection: 1 vial of Pregnyl powder, 1 vial Pregnyl solvent, syringe, sterile needle, alcohol pads, gauze, and disposal container. Use only the solvent that comes packaged with Pregnyl. Your healthcare professional will advise you on the correct amount of solvent to use. Prepare your work site. Gather all your needed supplies. Always wash your hands thoroughly using antibacterial soap before you start. Remove the flip caps from the 2 vials. Wipe the rubber stoppers with an alcohol pad. Using the reconstitution needle on the disposable syringe, firmly hold the vial of Pregnyl on the work surface. Push the needle through the rubber top and withdraw sterile air. Then remove the syringe from the vial of Pregnyl. Firmly hold the vial of solvent on the work surface. Push the needle through the rubber top and press the plunger to inject air into the vial. Next, turn the vial and syringe upside down, keeping the needle tip below the surface of the liquid. Slowly pull back on the plunger to the CC calibration mark appropriate for your prescription. You will need to gradually withdraw the syringe from the vial as you do this to keep the needle below the surface of the liquid. Inject the solvent into the vial of Pregnyl. Gently swirl, do not shake, the vial until the Pregnyl solution is clear. If the solution is not clear or has particles in it, Do not use it. Draw the reconstituted Pregnyl solution into the syringe. Dispose of the reconstitution needle and replace with sterile intramuscular injection needle. Tap the side of the syringe so air bubbles rise to the top. Intramuscular injections are given in the muscle tissue beneath the skin. The best site on the body for an intramuscular injection is the buttock. A partner will have to administer the injection. Imagine that the buttock is divided into 4 quadrants. Inject only into the upper outer quadrant. Keeping to this part of the buttock allows you to avoid nerves and blood vessels. To locate the proper area of the buttock for injection, place your first 2 fingers on the top edge of the hip bone and point the thumb of that hand toward the crease of the buttocks. The curve between your thumb and fingers will outline the proper area for injection. Some women prefer to lie face down for a buttock injection. Others prefer to stand, leaning on a table or chair, with toes pointed slightly inward to release pressure on the muscles of the buttock. Shifting all the body's weight off to the side to be injected relaxes the muscle and lessens muscle soreness. Clean the injection site with an alcohol pad and allow it to dry for 1 minute. Spread the skin at the site with firm hand pressure. Hold the syringe in your dominant hand as you would hold a pencil, around 3 inches from the skin surface at a 90-degree angle to the skin. With one smooth, swift motion, insert the entire length of the needle into the skin. Let the skin relax. Pull the plunger back gently and slowly. Sometimes a small amount of blood appears in the syringe. If you see any blood in the syringe, remove your thumb from the plunger, withdraw the syringe, replace the needle with a new sterile one, and immediately inject again. Properly dispose of the first needle. If no blood appears in the syringe when you pull the plunger back, then you may slowly and firmly depress the plunger until all the medication has been injected. Remove the needle and discard it and the syringe in the safety container as instructed by your doctor or nurse. If any blood appears on the skin after the injection, apply pressure with a gauze pad for a few moments, or tape gauze to the skin. Gently massage the skin while pressing lightly to disperse the medication. If you have any questions about Pregnyl, write them down and ask your doctor or nurse during your next visit. For more information, call Merck & Company at 1-866-836-5633 or visit their website at www.follistem.com. For support services, you can visit www.fertilityjourney.com. So that's how to self-administer Pregnyl. But remember, your healthcare professional may give you somewhat different procedures. If so, follow their instructions. They know your individual situation, and never hesitate to ask questions. Fertility treatment can often be very demanding. Hopefully, your treatment with Pregnyl will lead to successful pregnancy.